Welcome back to 3 Plus You. Well, as I start the journey through my 50s, boy, heart health is something I'm very concerned about. You either are or at least should be. You can be feeling fine and your heart may not be as healthy as you want it to be. Here to talk about it, we have from the Chattanooga Heart Institute at CHI Memorial, Dr. Newton Wiggins. He's a cardiac electrophysiologist with the Chattanooga Heart Institute at CHI Memorial. And we're talking today about atrial fibrillation. But now, people sitting out in the audience, I guarantee atrial fibrillation doesn't involve me, couldn't care less. But it could, and they may not even know it. Why? What is atrial fibrillation?
Well, first off, we can call it Afib for short.
Thank you. Jeez, getting exhausted just saying it.
So Afib is an abnormal rhythm of the top chambers of the heart that usually results in a rapid and irregular heartbeat.
Now, is that something that people are born with? Is it something that is behavior oriented? What is it?
So usually it develops over time, usually as people get older, although we do see it in young individuals. But there are many risk factors that put you at risk for developing atrial fibrillation, particularly heart disease, but also high blood pressure, diabetes, sleep apnea, things that are extremely common. So it's really important to diagnose Afib.
Okay, so we diagnose typically when people come in to see the doctor, and people don't come in to see the doctor. We know that unless they're sick, unless something is hurting. That may not be the case with Afib, though. It may be asymptomatic, although you say there are some symptoms that can go along with it. What do people need to know?
That's correct. So again, usually it results in a rapid and irregular heartbeat.
And will you feel that? What does that feel like if you have a rapid, irregular
We call
heartbeat?
it palpitations, but like the heart is pounding in the chest. So that's one of the classic symptoms of Afib. Some people have chest discomfort. Other people will get dizzy or lightheaded. Some people develop shortness of breath. But also there are patients who have absolutely no symptoms until something bad happens, like having a stroke or having heart failure, which also is associated with atrial fibrillation.
So is Afib part, because all the symptoms that you were describing, I've heard described as symptoms of a heart attack. I mean, is that a precursor to a heart attack?
They are not the same. So Afib is an electrical problem of the heart. A heart attack is a plumbing problem of the heart. So it's a clogged artery, so there's a lack of blood flow to the heart muscle. Afib is something different.
Okay, so is it fatal? Do people go their entire lives, die a normal, live a normal lifespan and never even know they have it?
So again, Afib is extremely common. There are about 3 million Americans living with Afib. Not everyone knows it, which is why we're trying to raise awareness. September was actually Afib Awareness Month this past month, so we're kind of coming off of that. And that's why it's so important, because if it's left untreated, undiagnosed, it does put patients at risk for developing a stroke as well as heart failure.
Are you pretty convinced that some people watching right now are sitting at home with Afib, don't even know it, but probably need to come get checked out?
Absolutely.
So what is the getting checked out procedure? Do they come see a specialist, a cardiologist? Do they go to their family doctor? Are they qualified to treat it?
Yes, so the easiest way it's diagnosed is with an electrocardiogram or an EKG, and this is very common in any doctor's office. So see your team, and if you get a screening electrocardiogram, and that should provide the diagnosis, and then a referral to a cardiologist as needed. However, there are some other ways that we've been seeing more patients with Afib, and it's actually with smartphones and smartwatches. There are some algorithms within these tools that have diagnosed successfully Afib, and we are seeing more and more patients who are presenting that way.
Are you serious? Like the Apple phone, whatever it is that you wear on your wrist, like the what's the thing that everybody where you walk and it counts your steps? Fitbit. So is it the same kind of technology?
It's similar. Each one has different algorithms. So the smartwatch actually, through Stanford University, they have a study that they have just closed because they've had enough enrollment to see if their algorithm is going to be successful in diagnosing atrial fibrillation. But there are other brands out there that we definitely have seen successful diagnosis of atrial fibrillation.
So if nothing else, people need to adapt whatever Fitbit or smartwatch that they're wearing.
Well, a word of caution on the wearable technology. I mean, nothing will substitute for a good old-fashioned electrocardiogram and seeing your physician.
Right.
Absolutely.
Yeah, but as a first step, if you're not going to do anything else.
Right.
But what kind of time frame are we talking about? Somebody wants to schedule an appointment, they're in, they're out, no big deal?
Absolutely.
I love it.
It's quick.
Well, tell people how they can get in touch with you and how they need to, what do they need to do? What's step one? You know, I've been having some of the symptoms he described. Maybe I need to go get this thing done.
Right, so we're happy to see anyone. We're at the Chattanooga Heart Institute, and we're happy to see anyone for this very reason, but also with your primary care doctor, your family physician, nurse practitioner, anyone in the medical community would be able to provide that type of service.
I'm telling you, heart health. Dr. Newton Wiggins, he's the cardiac electrophysiologist with the Chattanooga Heart Institute at CHI Memorial. 6 locations. There's one that can get that electrogram. I'm going to mess it up.
Electrocardiogram.
Electrocardiogram.
EKG.
EKG, get it done. EKG, Afib, EKG. I think I can be a doctor too. The Chattanooga Heart Institute at Memorial, we love when you guys come on. You are literally saving lives, and appreciate your time. We'll take a quick break. More 3+U when we return right after this.